infection and antibiotic. طيب, definition of infection طبعا it's an invasion and multiplication of microorganism within the tissue. طبعا يكون في tissue reaction, could be surgical or medical infection. What is the difference between infection and colonization? Colonization is multiplication of microorganism with no tissue invasion, okay, and no reaction. واضح? Sterilization is a complete destruction of all forms of microbes. Decontamination decreases the number of living and germinating microbes. And you have to know some methods of sterilization like heat and pressure, dry heat, hot air, chemicals, radiation, ultrafiltration. طيب هنا عندنا أنواع من الانفكشن. أحيانا تكون non-suppurative like cellulitis on the left side of the picture of the screen. This is only cellulitis, subcutaneous infection. Sometimes يكون في collection of pus like an abscess. It needs to be drained. Sometimes يكون في infection deep in the tissue causing necrosis of the tissue itself, which needs excision of this necrotic tissue, like necrotizing fasciitis. Elements of infection process طبعا عندنا pathogen either virus or bacteria or fungus, عندنا الhost اللي هو the patient himself, and عندنا route of transmission اللي هي either blood or lymph أو غيره. Pathogenic factors. What is virulence? Its ability to evade the immune system, invade the tissue, multiply and spread. Toxins, a substance that are secreted or released from the dead bacteria. Synergism is a mixed infection by decreasing oxygen tension, like synergic gangrene or necrotizing fasciitis. Antibiotic resistance. Most bacteria are able to change its antibiotic sensitivity and show resistance to the antibiotic when used improperly. That's why we have to make sure that we give the patient the correct antibiotic. طبعا نبدأ broad spectrum antibiotic and then we go based على tissue culture أو blood culture or whatever. Host factor. Age is very important. Extremes of age are usually vulnerable to the infection. طبعا pediatric and old patients are more they have more risk for infection. Medical conditions very important: diabetes, end-stage renal disease, liver disease, malignancy, immunodeficiency, all of that. Medication like immunosuppressive medications and chemotherapy, previous exposure or vaccination as well. Okay. To prevent the recurrence of infection like TB, for example. Also, some of the host factors, intact barriers, and then a mechanical barrier like skin and mucosa, chemical barriers like gastric acidity, hormonal like IgA. All of these are important. Route of transmission and environment. زي ما قلنا like bloodstream, like bacteria bacterial contamination cause fastest and worst clinical picture like septicemia. Some of the bacteria, we have to know that some of the bacteria are non-pathogenic in certain places, but are pathogenic in some, like E. coli in the colon. They're not. But if they go to the urinary system, they can cause infection. طبعا عندنا normal bacteria flora كثير. You don't have to remember all of that, just to know what is the normal bacteria flora and the nose and throat, and the GI system, the skin. So it's always, there are some specific bacteria are normal at those places. Preoperative antibiotic prophylaxis is very important. So means one dose or short-term preoperative antibiotic coverage with no evidence of infection. Okay. It's to decrease the incidence of post-operative wound infection. You have to remember that wound infection, not something else. Okay. It should cover the expected bacteria flora اللي هي في السكن طبعا. So that's why most of the antibiotic used as third generation cephalosporin. It is, yeah, you don't have to know all of that. Here is important. This slide is very important. Classification of surgical wound according to the degree of contamination. أكيد مرت عليكم من قبل. There are clean wounds, clean with implementation of sterile prosthesis. هذه دخلناها بس شوي زيادة. Clean, contaminated and dirty. هي كثير من الكتب تقسمها 4 بس احنا حطيناها 5 هنا بس. هذا رقم 2 هذه kind of more يعني detailed. So clean wound, like what? Like working in the thyroid, in the neck, for example, for thyroidectomy or carotid body tumor resection or carotid endarterectomy. Okay, these are clean. Clean with implantation of sterile prosthesis. أنت عندك clean wound لكن أنت حاط prosthesis جوا. So if you have a prosthesis معناته عندك foreign body, so a good environment for infection. لكن ما لها علاقة في الwound. الwound is clean. واضح؟ As you're doing, for example, carotid procedure, which is in the neck, clean wound, but you're putting a graft, synthetic graft, in the artery or patch. So that's why you have to be a little bit more worried than if you don't put any synthetic material. واضحة؟
واضح يا دكتور.
Clean
زي
contact.
البيس ميكر تقصد صح؟
سم؟
زي البيس ميكر نفس الفكرة انه يكون
نعم.
الجهة كلين
نعم.
تاخذ لها
نعم. يعني انت عندك مثلا thyroid surgery is a clean, okay, wound. carotid surgery is a clean wound. لكن لما اسوي carotid surgery ويصير عندي مشكله في الارتري ولا I resect some piece of artery واحط synthetic graft كويس, it's still a clean wound بس عندي foreign body انا حاطه جوا, so the foreign body usually increase the risk of infection. واضح؟
واضح الله يعافيك.
Clean contaminated where there is a breach of sterilization or opening of a prepared bowel. Prepared, لاحظ انها prepared يعني clean bowel. Okay? Contaminated لما يكون في drainage or excision of infected tissue like acid. Dirty in case of major contamination or excessive necrotic tissue. واضحة؟ نجي على ال SSI, surgical site infection. So, infection at the surgical site can be classified into superficial, deep, or cavity. What does that mean? Superficial? Like what? Only superficial with cellulitis. Deep لما يصير عندي collection. I mean under the tissue, under the skin اللي هي abscess formation. Or cavity لما يكون في abdominal or thoracic cavity collection. واضح؟ So the treatment starts with what? أول شيء infection prevention in all elective cases and most of the emergency cases. طبعا نعطي prophylactic antibiotic even in the emergency cases in the OR just before you start you give 1 dose of cefazolin, for example. Number 2, early recognition and treatment of the infection is very important because when you detect recognize the condition from the infection from the beginning, you will start antibiotic, you will treat it. It's better than late. Prevention of infection. طبعا there is a lot of things including medical personnel اللي هي screening for MRSA, for example, isolation of patient with contagious infection, proper hand washing للpatient himself and for the health practitioner, decontamination of the surface and articles, precaution when treating infection disease and infected patient, preoperative washing and antiseptic shampoo, prophylactic antibiotic, proper sterilization, proper surgical scrub, isolation of the infected part or material, طبعا يكون في good or sound surgical technique. Okay, all of that will help protecting and preventing all of the infection. Early recognition and treatment of the infection, detection of early symptoms and sign of fluid collection or infection. Most collection should be drained for fear of infection. Okay, symptoms and signs that could be attributed to post-operative infection like what? Pain, swelling, or period discharge. طبعا احنا لما يصير عندنا seroma for example, big seroma, it's better to drain to prevent infection. Big hematoma as well, sometimes you just drain it to prevent infection لأنه يصير عندك good media or environment for infection. Any question?